Hey everybody, my name is Tyler McCrary, and today I'm going over proper sterile collection techniques for different types of cultures. So this is my little pamphlet I made, and I'm just going to be referencing this throughout, but I actually have different sources for collection that I'm going to go over for different types of cultures. So firstly, with bone culture collection, at my hospital, this is done during surgery or other biopsies, and we can't, in the lab, we can't necessarily reject the sample because it's not something that you can just recollect. Because they only have one bone once, so you can't put it in for a recollect or anything. But just an example of a container that they use for different types of bone cultures. Let me open it real quick. So obviously this is a sterile dry container. That's why it's in this bag to keep it sterile. If I can just open it real quick. And this is kind of like what I have listed in the picture on the pamphlet. It's just a sterile, dry container. It has a way you can label here. We have patient labels that we print out, and actually, so we don't write anything on them. So what they do is during surgery, I mean, you would assume that the surgery site is sterile. So when they cut off the piece of desired bone or anything, it's really just as simple as opening the lid and placing it into the container. Obviously, when you open the lid, you want to avoid like touching the inside or anything. Like if you were to open it and then pick it up and move it, you wouldn't want to like grab it like this. You always want to keep your fingers on the outside to avoid like contamination with any normal skin flora like staph epi and stuff like that. So that is what you use for bone cultures. This can also be used for tissue cultures as well. For example, we get toes a lot. So if during surgery they were to amputate a toe and put it in this container, this would also just be another sterile dry container that could be used. There are some times when they may want it in like a diluent, but we don't request that unless like we specifically instruct them to. We do put some tissue specimens on formalin, but that's mainly for pathology to review. But when we're actually receiving it in the lab to create a tissue culture, we receive it in one of these containers as just a toe in a container, really. And once it gets to the lab, we have our techniques to keep it sterile when we cut off a piece of the toe and like grind it and get it down to where it can be plated. But for just standard collection, we also can't necessarily reject these either because I mean, if it's a toe, you can't really recollect a toe or a different toe or something. So yeah, we just keep it in these containers. Um, and for both bone and tissue cultures, it is best to be delivered to the lab within 30 minutes. That way it's just fresh and there's no other sources of contamination. Let's see. So for wound culture collection, that's where you can use more or different methods to do it. So before collection, you want to clean the superficial area with sterile saline and remove any debris. So let's say, for example, we're collecting a site from my arm. We have these little wipes here. These are just sterile saline wipes. And let's just say that this area right here is where my infection is. So any of the superficial area, we don't want to put it in the actual infection site. You want to just clean the skin around it. That way you kind of remove any of that, normal skin flora. You don't want to contaminate the swab with anything that's not causing the actual infection. So I rubbed my arm around the area of infection. And so there's multiple different types of swabs you can use. It just depends on your hospital and the procedure. So we have four different types of swabs. Um, this one is what's called a Q swab. And basically what this one's meant to do is it is a sterile swab, so when you open it, it is sterile. Um, but what this one's meant to do is you can actually put it in the container after you swab it because this actually breaks. So if you were to, roll it around the infection area, and there shouldn't be any contamination since the area was wiped, you just roll it around the infection area a few times, and then you can actually stick it in another sterile container like this or something more designed to fit the swab. It'll actually, you can just stick it in there, break it off. So I broke it in two pieces so it can actually fit in the container. So that's one way to doing it. A lot of times, mainly e-swabs are used the most now for wound cultures. Um, and this is an example of an e-swab. There's a diluent at the bottom. And what this allows you to do is it is sterile, it is sealed. You just twist the top open. And again, you would just rub the area of infection, five times, place it back in. And the reason we like to use these is because it has a diluent, so it's very easy just to stick your inoculating loop in there and then streak your plate directly from the diluent. There's no need to like inoculate a broth and then wait a day and then you have to inoculate your plates. That just makes it more of a streamlined process. So I do have this is another collection kit, and this one you can actually see the diluent in it. So this is actually used for COVID-19 testing, but I brought it as an example for um, the diluent. As you can see, it comes with a swab and a container with diluent inside. And you basically let's just pretend this is for a wound culture. You would swab the area of infection 5 times, as stated in the procedure. And then again, this one also has where you can break off. So you would stick um, the swab in the transport tube, break off the container, and then reseal it. And that keeps everything sterile and avoids any contamination in the micro lab. So I also have some ways of how it should not be done. So these are just standard wooden applicator tips. You can really use them for anything, but you cannot use them for culture collection because first of all, these are not sterile. These just come in a box. There's no way of sterilization inside. So we have received these before in the lab where the nurse may just go and, rub this on the infection site, stick it in an existing like swab packet and send that to the lab. But we have to reject that because it's not sterile. There's probably contamination all over it, and it would invalidate the results. And the goal, the overall purpose of sterile collection is to ensure accurate identification of pathogens and to avoid any possible delay in treatment. So, I mean, that basically covers the sterile bone culture, tissue, and wound culture collection. And one of the most important things is just to especially with wound cultures, is to clean the area with sterile saline and roll the swab over the infected area. You want to avoid touching areas that aren't infected. That just opens up contamination for normal skin flora, and it just makes the lab's life a lot easier the way if things are done sterilely and avoid. I mean, you're always going to have contamination in the lab, and when you're collecting, it's just part of it. But the less it occurs, the better. So thank you for watching my presentation.